Hey, and welcome back to Imperfectly Perfect with Kay. And I'm coming to you with new content in reference to how to ace that patient care tech interview with 16 questions. Don't miss out. Stay tuned. Okay, guys, let's get straight into the 16 patient care tech interview questions. These interview questions are pertaining to daily activities that we do with our patients, and also past experiences that we've had with other residents or patients that we may have cared for in the past. So, first question is, what are vital signs? A pretty simple, basic, easy question to answer. To go a little bit more in detail of how this should be answered, just make sure that when you answer the question, be a little bit specific. Try to elaborate a little bit, but not too much. Just you can say something to the nature of, there are measurements specific to pulse rate, temperature, respiration rate, and blood pressure. This is to understand or indicate the state of a patient's body at the time of admission, or as they are there in our care. Question 2. How often should you monitor vital signs? And how would you know if there is something wrong? So with this question, if you've ever worked in the hospital as a patient care tech, you know that we have two methods of how and when we should do vital signs. So the first would be every 2 hours, and those are patients who are on telemetry. They have to be monitored with a small heart monitor. They are to be done every 2 hours, but normal would be every 4 hours. So in the morning at 7, the next time I think is at, the next time is at like 12 at noon or 1, and then after that it is right at, well, we started at 6:30 right before the next shift change is over. So because I was 7A to 7P, so before shift change. So those 3 times within the shift, you are supposed to do vital signs on your patients. All right, next question we're going to go into is question 3. What tools and equipment should a P.C.T know how to use? Basically, everything that we touch, we should know how to use. That is automated IV pumps. That is just controlling the dosage, cutting it on and off, or pausing it until the nurse comes and either remove the IV or attach more meds to the IV. Next would be portable monitors like telemetry machines and glucometers when you're doing the capillary blood sticks. Next is going to be the smart beds. As you know, working in the medical field in the hospitals, we have the smart beds. In nursing homes, they don't have them as much that I've seen of. But in the hospitals, you will see a lot of the smart beds. It's just you need to know how to adjust the bed into different positions based on the care of the patient, and how to do bed alarms and stuff of that nature. So keep that in mind as well. Also, stethoscopes, we should be knowledgeable about. Electronic health records, which are the charting system that they use in order for you to chart on your patient, and they keep track of the care throughout that day. Next is the telehealth apps and centralized command center. Centralized command center actually is for all nurses throughout the hospital. Just to the centralized command center is for us to be able to call if we need a password reset for us to get into the P.C.T, the electronic health records, if we're unable to get through whatever other software that they have for us at that time on that system that you have at your hospital. Let's see. Next question is going to be the P.C.T's work is often demanding. How do you stay motivated? So with this question, is practically based off personal experience. What keeps you motivated? What helps you to keep going for those 12 hours, 8 hours, 12 hours, however long you're there? You can name things such as staying focused on patient care, listening, being very attentive to the patient's needs, empowering your patient, and understanding the patient's motivations to help them get in and out of the bed, motivating them to, continue to do things so that they can advance in their care for them to be discharged to go home. So keep those few little things in mind too. You can dress it up however you want. If you have other things that you would like to say, go ahead and add those, but make sure you keep it simple and sweet. And for the interviewer, next is going to be directed mostly towards the patient care tech 2s. And as I've stated before in the previous video, when patient care tech 2s are different from patient care tech 1s. They just have a more certification, more background. So they are trained and certified in phlebotomy and EKGs. And that they get that through the school that they went through, or they could go back and get that separately from whatever. So all you CNAs out there, you can go and do the same thing. Even if you didn't take a patient care tech course, you can still go and take a course for phlebotomy and get your phlebotomy, and take a course for EKG and get your EKG technician certification. So it's all the same. It's just that patient care tech 2s are more advanced and more skilled when it comes to them having their credentials in certification in phlebotomy and certification in EKG. So now question number 8. Question number 5, I'm sorry. Question number 5 says, how would you go about performing an EKG test? All it is that you have to be specific when you are giving them the rundown of how you would perform this test. You just let them know the steps that you will take in order for you and the patient to be comfortable, and for you as the patient care tech to be successful in getting what it is that you need from the patient in order to have this test administered to give to the doctor, so that they can monitor their care. So next question is going to be question 6 for our patient care tech 2s, is what's your experience preparing patients for surgery? So, working in the hospital, we do have our standard procedure of how you as a patient care tech will assist in the surgical baths. Each hospital will be different with how they do things. Just make sure that you follow what was taught, or what was trained, and the information that was given to you at the time on your floor on how you were supposed to do it. In nursing homes, you don't have to do that, because the patient leaves the facility to go to a hospital in order for them to take care of all of that. So CNAs don't have to worry about anything like that. Next question. Have you used any software as part of your job? So they just want to know about the software, in particular, what programs was used at your hospital that you worked with before. Is it similar? So they would know, is it similar for, was their software similar to were their software was similar to our software? Will you need additional training behind the software? Or, how easy is it going to come to you? That's all. So you just let them know what software was used at your facility and leave it at that. Next question is, what is the biggest challenge you faced in the past as a PCT? This is a personal experience type of question. Just make sure that you're specific to the time and that challenge. Give them a good one. I would say give them a real good one, but just make sure that this is one personal to you, and I think you'll blow them away. No problem at all. All right, our next question is, are you trained in phlebotomy and dialysis? Like I told you before, most of our patient care tech 2s are trained as or have a certification in phlebotomy. Dialysis, we get the training, but we're not certified in it. We could go back and take a course in being trained so that we could get certified in dialysis, but we are not certified dialysis technicians, but they do allow training in the hospital. So if that is something that you're interested in, make sure you speak up. Okay, and furthermore, so now we're going to head over into the behavioral questions, which are very important because these questions, they want to see how you are able to handle difficult patients. So the first question with this one is going to be, tell me about a time you discovered a safety hazard in your job and what did you do? You know, we have these a lot working in the healthcare center. So just make sure it's personal to you. Make sure it's a good personal experience, and just explain and explain how you were successful in correcting the safety hazard at hand. That's all for that one. Next question is going to be, recall a time when you had to take care of a difficult patient. How did you manage? Alrighty, so when you are answering this question, you just want to make sure that you listen to the complaint and identify the problem. Don't lose control. Remind the patient you expect to be treated with respect. Emphasize with the patient and find a solution. The quickest solution and easiest solution as possible. And that way everything runs smoothly, because sometimes those situations can be difficult to get out of. But as long as you keep as long as you stay cool and don't lose control, listen very carefully, then you should be okay when dealing with patients like this. But just make sure, if you have had this experience before, you just explain how you were successful in a situation like this, because that's one of the top questions that they will ask you. I know that for sure. All right, next behavioral question is going to be, have you ever received orders from a nurse who you didn't agree with? What did you do? Everybody's experience is different when it comes to this. So you just make sure that you give them a honest and respectful answer to answering that question. Next one is another behavioral question, and this one is based on personal experience as well. So I really can't tell you how to answer these questions. These are based off what you've already been through as your patient care technician. So this question says, describe a time when one of your patient's conditions suddenly took a turn for the worse. What did you do, and where were you emotionally involved? Now, sometimes that question is going to be hard, because a lot of us do get emotionally involved when it comes to our patients who drastically illness turns for the worst. So just make sure you keep in mind your experience. Let them know how it affected you, and I think you'll blow them away with it. Next behavioral question is, give me an example of a time you educated a patient in a health or safety matter. And with this one, it's just basically detail, being specific to what the situation was that you had to educate them about, and how did you explain to them about their safety within that matter. That's all that is for that one. So that's the end of the behavioral questions. The next few questions are going to be operational and situational questions. There's only 3 of these that I could find. If there are more, I'll come to you guys later in a different video, and we could go over these questions. But the first operational and situational question says, imagine that one of the patients is rude and uncooperative. How would you handle this? Now, this question could also be a behavioral question, but they put it under operational and situational questions. So You just want to, as I said, imagine that one of the patients is rude and uncooperative. How would you handle this? You know, you always stay calm in situations when it comes to patients being difficult to deal with. So you listen to the complaint, identify the problem, never lose control. Remind the patient that you expect to be treated with respect, but do it in a respectable manner. Don't just speak to them any kind of way and demand respect, because it's not going to do anything but make the situation even worse. So you just want to calmly assess the situation in your head before answering the uncooperative patient, and then follow through what the next steps are. All right, next question is, if a patient care tech of the next shift called in sick when you're about to leave, what would you do? Now, this is another personal experience type one. It depends on you, because most healthcare workers they have families. So this situation could be a little bit difficult, because sometimes in urgent matters, the hospital will say that you have to stay. But if you speak to them and talk to them and let them know your concerns and the other your other responsibilities that you have outside of work in reference to your children, just let them know that you can stay for like 3 or 4 more hours, but you won't be able to do a whole shift, or, you know, something like that. But speak with them, because those managers that they have in place are able to work with you, and they are going to make sure that they consider every avenue before having to force you or make you have to stay on an account of another employee not coming in. So just make sure that you have good communication with your heads that you work up under. Next is, what would you do differently when caring for different age groups? Now, this question, I've never had to answer this question, which was a little tricky question, but I would just say always remember that each age group is uniquely different in characteristics and needs. So you want to just be mindful of the age group and assess the situation as you should, and handle each age group appropriately. And if you have any issues, I'm pretty sure that everybody that is working on your floor or who has had to deal with a situation with different age groups will be able to help you manage and get through. So, you guys, I hope that you jotted down all 16 questions so that you can work on these in your free time before that interview takes place. I wish you guys all the best. If you have any other questions that you want me to answer or help you answer, please comment below. I'll get back to you as soon as possible. If you have anything else that you want to ask me about patient care tech, I'll be more than happy to answer those questions as well. Just make sure that you like, comment, and subscribe. Hit that thumb button if you did like the video. But I hope to be hearing from you guys soon. You have a blessed day.